Pharmacology of emergency medications. Introduction. Patients are often transported to the radiology department to be kept under direct supervision of the imaging technologist. The technologist may have to deal with a patient experiencing an acute life-threatening condition requiring emergency action. A technologist should have a basic understanding of the life-threatening emergencies that can occur in the radiology suite. Situations could include cardiac arrest, choking, seizures, fainting, shock, and emergency diabetic. Cardiorespiratory arrest. Cardiac arrest is a condition when the heart ceases to pump blood adequately to the rest of the body. A respiratory arrest is a condition when the patient becomes unable to breathe, causing a lack of oxygen to the body if not handled properly. Can lead to cardiac arrest, so cardiorespiratory arrest. Time is life. The American Heart Association reports that the highest survival rate after cardiac arrest occurs in patients who receive CPR within 4 minutes and medications within 8. I'll repeat that one. The American Heart Association reports that the highest survival rate after cardiac arrest occurs in patients who receive CPR within 4 minutes and medications within 8 minutes. A patient with no blood circulation for more than 4 minutes will likely have brain damage. More than 8 minutes without circulation being restored could be death. Therefore, the technologist cannot rely solely on other medical professionals to provide care to the patients experiencing life-threatening conditions. Your role. All healthcare workers should be certified with BLS, Basic Life Support. You should immediately begin CPR after calling for help. The technologist should always keep in mind that even though the code may be called, the emergency team may possibly be delayed or may need extra assistance. Technologists should also be familiar with all of the codes in the respective hospital they are working at. Emergency medications for cardiorespiratory arrest. Preparation made in advance of any emergency is critical. Technologists should be familiar as to where the crash cart is located in the department. Check the crash cart daily to ensure that all drugs are present and not expired. Acquiring this knowledge of the drugs and location of them will allow swift and efficient handling during emergency situations. Epinephrine, which is adrenaline. One of the most valuable and potentially life-saving agents for cardiac arrest victims. This drug is equivalent to adrenaline, which is produced by the adrenal glands. It mimics the sympathetic nervous system by affecting the receptors that are stimulated by epinephrine. In cardiac arrest, epinephrine stimulates receptors so that arterioles can constrict, producing an increase in the blood pressure. In combination with chest compressions, this drug can cause a return to spontaneous circulation. Epinephrine continued. Onset of 1 to 2 minutes with a duration of 2 to 10 minutes. Indications: cardiorespiratory arrest such as ventricular fibrillation, anaphylactic reactions, and acute bronchospasms. The dosage is 0.5 to 1 milligram every 5 to 10 minutes, followed by normal saline. The method of administration is IV, via endotracheal tube for intrapulmonary injection, intraosseously into the bone lumen, intracardiac injection into the left ventricle. Myocardial necrosis could result. Adverse effects: cardiac dysrhythmias, increased ischemia, benefits outweigh the risk, sense of nervousness, headache, and muscle twitching. Stability: very unstable when exposed to light for long periods, may turn pink or brown. Do not use because they may be ineffective. Vasopressin, which is also pitressin, pharmaceutical equivalent to antidiuretic hormone. Vasopressin has shown to increase blood flow to the vital organs and improve the oxygen delivering to the cerebral area. Standard therapy as an alternative to epinephrine. Studies show significant improvement in survival with asystole, no cardiac activity, patients who receive vasopressin as compared to epinephrine. Onset of action within 3 minutes, with maximum effect occurring at up to 20 minutes. Rapidly destroyed by the liver and kidneys, therefore its half-life is 10 to 20 minutes. Indications: recommended as an alternative to epinephrine for cardiac arrest patients. Dosage: IV push at 40 units for 1 dose every 20 minutes. Adverse effects: pallor, sweating, nausea and vomiting, tremor, abdominal cramps, MI, and hypertension. Dopamine, which is also known as entropin, precursor to norepinephrine and epinephrine, which is naturally produced by the body. Hormones secreted by the adrenal glands to give the body sudden energy in times of distress. It stimulates dopamine receptors in the renal, coronary, intracerebral, and mesenteric arteries, leading to arterial vasodilation, increasing the blood flow to organs. Increases cardiac output in patients in shock or congestive heart failure. Onset of action in 2 to 4 minutes with duration less than 10 minutes. Renal vasodilation with the increased urine output may take up to 20 minutes. Indications: hypotension secondary to heart failure, MI, trauma, sepsis, increased urine output in patients with renal failure. In emergency situations, dopamine may be used after epinephrine failed. Method of administration is 5 to 10 micrograms per kilogram per minute through an IV infusion. Adverse reactions: hypotension or hypertension depending on dose amount, cardiac dysrhythmias, headache, nausea and vomiting, angina, and tachycardia. Stability: once compounded, only good for 24 hours. Check for discolored solutions. Atropine, anti-muscarinic, which is anti-Parkinsonian agent used with patients experiencing cardiac arrest. Inhibits action of acetylcholine, used when patients experiencing cardiac arrest and exhibiting bradycardia with a heartbeat less than 40 beats per minute. Onset of action in 2 to 4 minutes. Half-life is 2 to 3 hours. Method of administration is IV, oral, intramuscular, and pulmonary routes. Can also be used when attempting to intubate a patient and their heart rate drops. Here we have an image of them intubating a patient. Atropine continued. Adverse effects is worsening of MI, ventricular fibrillation, ventricular tachycardia, dry mouth, bad taste, blurred vision, constipation, and mental confusion. Lidocaine, which is also xylocaine, one of the most frequently used antiarrhythmic drug for patient experiencing cardiac arrest. Onset action is 30 to 90 seconds. Method of administration and dosage is IV or intramuscular, 1 milligram per kilogram. Very viscous, so usually stings. Rapid distribution to the bloodstream, usually need to administer 2 bolus doses 10 minutes apart. The indications: ventricular dysrhythmias and heart attack or cardiac arrest. Indications: ventricular dysrhythmias and heart attack or cardiac arrest. Adverse effects: if infused too rapidly, may experience drowsiness, confusion, nausea, and dizziness. Amiodarone, an anti-dysrhythmic agent used in cardiac arrest patients, suppresses dysrhythmias, has been used more and more since it may be administered in situations when the exact focus of the rhythm disturbance is unknown and when the patient has a heart condition. Although rapidly distributes throughout the body, its half-life is very long, 58 days. Method of administration is IV or oral. Can also be used as a rate control for patients with atrial fibrillation or flutter. It is important to note that amiodarone will cause hypotension. Therefore, if the patient is already hyposensitive, administer the dose very slowly over 10 minutes. Once compounded, this drug is only good for 24 hours. Sodium bicarb, strong alkalizing agent used to treat cardiac arrest. Bicarbonate serves as one of the main chemical buffers in the body. During cardiorespiratory arrest, the patient cannot ventilate and the body will then begin to process anaerobic respiration to try to help supply energy to the tissues, but the end product is lactic acid, which can cause metabolic acidosis. A combo of sodium bicarbonate and artificial respiration is used to combat acidosis. Sodium bicarbonate is not commonly recommended as an absolute treatment due to the other drugs being more suitable. Method of administration is IV. Adverse reactions: if injection is infiltrated, cellulitis, tissue necrosis, and ulceration can occur. Also known as paralyzing agents. Neuromuscular blockers are also known as paralyzing agents, used only by clinicians skilled in intubation technique. Usually used with a sedative to intubate a patient rapidly if they do not breathe on their own within 8 minutes of beginning CPR. The end.